Hey, let's do this. Thanks so much for joining, everyone. So my name is Harrison. I'm on the customer success and operations team at Tali. I'm joined by Hesam, our co-founder and CTO, and three amazing panelists, Tracy, Amy, and Jeremy. And we'll go through introductions for all of our great panelists when we get to that part of the presentation and discussion today. Today's topic is all about navigating privacy and compliance in AI Scribe adoption. As an organization at Tali, we're so thrilled everyone's taking time to want to know more and has expressed interest in this topic. It's something that's very top of mind for us as an organization. And given all the work that we do in this space, we thought it would be a very timely discussion to bring a panel of experts from across North America to be able to weigh in on this topic and help those who are interested in AI scribes and adopting them for maybe the first time or through a repeat project think about privacy and compliance in a new and interesting way. And we're thrilled to get started. So yeah, on behalf of the Tali team, thanks for taking time out of your busy schedules for this. I'll pass it off to Hesam. He'll give a lay of the land for today's presentation and what the agenda will have in store. And then we'll get started right with our quick presentation before we dive into the expert panel.
Awesome. Thank you so much, Harrison. So hello, everyone. Thanks for joining the webinar. My name is Hesam Dadafarin. I am the CTO and co-founder of Tali AI. Today, we are lucky to have amazing panelists on the call. So if you have any question, please write them down and hopefully they can be addressed during the webinar. In the first session, I will cover our experience of building a secure AI solution and helping different organizations to adopt the AI. And then I'll share some experience about what kind of question we receive, how those should be addressed, and how those should be evaluated. And in the second part, as Harrison mentioned, we open up the floor to our panelists to talk about different nuances in the industry and gaps in the regulations. So a little bit about Tali AI. Let me give you the story of Tali. Before we started Tali in 2019, I was founder of another digital health company. Throughout that company, I built different provider and patient solutions for large hospitals such as CAMH and Unity Health in Toronto. And I also helped with a very large open source project that is being used by the government to encode and de-identify health data. So which means that I have been in this industry for the past maybe 12 years, and I have been working with different organizations from small to large entities. So in 2019, we got funding from PHAC, Public Health Agency of Canada, and the goal was for us to work on a state-of-the-art natural language processing algorithms to retrieve information from medical notes. This was our first module. And we were hoping that we build a prototype that we can compete with the products like UpToDate. We launched it during COVID, and at the time, many providers liked it because Tali was helping them to quickly get their answers from WHO, federal guidelines, and even the local authorities. If you remember the early days of COVID, nobody knew the answer to a simple question of what is the incubation period of COVID-19? WHO was saying something, federal government was saying something, provincial government was saying something else. So Tali was reading and digesting all of those information and presented and summarized it for the providers so they could make an assessment of their questions. And then in 2021, we further optimized the product. Well Health, one of the largest clinic owners in Canada, got interested in the product. And we co-designed the solution to become a voice-enabled virtual assistant and AI dictation for EMRs. Oscar Pro was obviously the first EMR that we integrated with. And if you remember the history in 2022, ChatGPT came out, and it was the turning point that machine learning models became smart enough that solution categories such as AI Scribe became viable. So in 2024, we got partnered with TELUS, one of the, or maybe the largest EMR provider in Canada, and NetHealth, which is one of the largest provider in the US with Allied Healthcare. And in 25, we are doing QHR integration, and we are building many more other features in addition to AI Scribes. So throughout these years, we have served thousands of providers, worked with large enterprises, and almost every month, I am personally filling out the security and privacy assessment questions for different organizations, and it's a repetitive process. So we are very close to the providers, EMR and EHR companies, and also governmental entities. And we are being consulted by different groups as a leading vendor in this industry about implications of AI from security and privacy perspective. So, since this is a evolutionary industry and the industry is evolving and different groups based on their main pain points are adopting various AI solutions. For each of these AI solutions, such as reducing documentation better or computer-assisted diagnosis, different assessment from security and privacy perspective is required. As a provider, one need to determine the role of AI in their workflow and what the responsibilities of each party is. Like, what should I do as a provider? Should I get consent or should I not? What is the responsibility of vendor? Where the data is stored? What is the responsibility of EMR in this chain? To make this a little bit simpler, I'll pick one of the Tali AI features, which is being used by thousands of providers, and dig deeper to demonstrate the nuances. So as you might be aware, Tali has different modalities. We have AI Scribe, we have medical dictation, medical search, and EHR assistant. All of them are voice enabled with our very accurate voice-to-text engine. So I'm going to, for the simplicity of this talk, I'm going to pick our AI Scribe module and talk about its security and privacy implications. Before I go deeper, I am going to just explain what is an AI Scribe. This is a typical workflow. So a clinician land on our website. It takes 2 minutes for them to register and onboard our platform. They would, based on their jurisdiction, they would get a patient consent, and we go to step 1. So this is like after 2-3 minutes. The clinician turns on Tali. Tali listens to the conversation of clinician and patient and transcribe the conversation. Then we go to the next step. We analyze the transcription to understand the key points with an LLM. And then on the third step, we instantly generate a summary, which could be a soap note, which could be a referral note, any kind of format that the clinician wants. And since Tali is integrated with different EHRs and EMR, the last step is that once the summary is created, the clinician can push a button on Tali and send those data back to the EMR to make sure that the data integrity is kept. So this is basically what AI Scribe does, but let me get a little bit technical. So what are the main components of an AI Scribe? Most of AI Scribes have 2 components, a voice-to-text engine, which does the transcription, and then a large language model, which does the summarization. Voice-to-text engine and large language model are considered AI. They are machine learning model. So it means that there was a training data to build them. They have certain accuracy, and they might have some biases because they are AI, and this is inherent for any AI solution. Both of these elements, as I said, help clinicians to focus on the patient conversation instead of keep typing on their EMR. So now we are dealing with a solution that has 2 parts, which uses AI. Assessing privacy and security of AI solutions become challenging because not everyone in this rapid evolving industry have enough protocol and processes to do the assessment. With that, let me share some of our experiences talking to different healthcare organizations and government entities. So let me give you a story. Like, it was 2017, before even we started Tali AI, and we were working in an office next to a healthcare association. They had a security breach, and they hired a consultant to make their system secure. Everything was going smoothly. 3 months after the engagement, one of the nurses was actually reading out their association credit card on the phone very loud that everyone else could hear. And that moment was enlightening for me because I realized regardless how you secure your infrastructure, human error can be one of the leading causes of security and privacy breaches. In other instances, like during Tali AI development, we go into many cars and security discussions are mostly limited to password protection, encryption of the data, where the data is stored, and some technical implementation. But security and privacy requires significantly more effort from the vendors and careful consideration during design and implementation. Hence, assessment is not only limited to a few things like encryption. Also, there is another misconception. So if the solution claims that they are HIPAA compliant or PIPEDA compliant or PIPA compliant, it's okay to use them. This is tricky for different reasons. First, HIPAA or PIPEDA or PIPA compliance is kind of a self-attestation. And practices and implementation are not necessarily audited by someone else. Second part is that the current regulation does not specify the details about what each solution should do in order to be HIPAA compliant. For example, regulations often set out general security standards but deliberately does not prescribe a specific technology or method of implementation. Like let's pick one sentence from HIPAA. They said that for example, for the security rule, it is recommended to use a reasonable and appropriate encryption, particularly when you're transmitting PHI over open network. However, HIPAA does not dictate which specific cryptographic method or tools you must use. This means that since they use the word appropriate, they put it on the shoulder of the vendor to implement the appropriate method. So the appropriateness can get very subjective from one vendor to another vendor, which is very risky. So at Tali AI, there are many nuances we realize to implement a secure and private digital solution, especially in AI category. Throughout several years, we came to a conclusion that you cannot just make a system secure if you don't consider security during the design. If you don't do that, you inherently implement a system which is not secure. Even after design phase, you need to follow many protocols to implement those design decisions safely. For example, how are we saving password? How are we setting up two-step authentication? Where do we store PHI? How do we protect access to PHI? All those sort of questions should be answered during implementation, and they should be implemented correctly. And eventually, when you develop a solution, you need to put or host the solution somewhere. Is it on-prem or in the cloud? How is your firewall setting? How do we inspect incoming packet? How do we patch vulnerabilities in the system? As you can see, the process is very involved. Now one may ask that if data deletion and encryption is not all that I should care, what else should I ask? So there are many questions that you as a provider or an organization who wants to adopt a digital health solution or AI-enabled digital solution should ask. From security perspective, there are maybe more than 50 or 60 questions that you should ask. So what is your development lifecycle? What is your password policy? How do you scan your code? What is your security response plan? How do you manage your library and vulnerability upgrades? And so on. As I said, this goes to maybe 50 or 60 questions, and the vendor should provide evidences and documentations about how they are actually implementing this correctly. On the privacy side, the same thing, maybe more than 50 or 60 questions that can be asked here. For example, how do you evaluate the output of your AI and safeguard against biases? Do you use PHI to train your algorithms? What kind of de-identification do you use? How do you track changes to different iterations of AI? And so on. These are just part of it is just AI, part of it is just related to the privacy. So now you say that, okay, I'm a clinic with 100 providers. It's true that I have an IT department and an internal privacy security checklist, but it's hard to catch up with all of the progress in the industry. So what should I do? There are a few things that you can do. So first of all, self-attestation of HIPAA or PHIPAA is the minimum. Like if a company said that I am HIPAA, GDPR, PHIPAA compliant, they are actually doing one thing for you. They create a common ground and same basis with you, which means that they are at least aware of the regulations that are necessary in the industry. The second thing that you can do to lower the risk is that if they check the company security and privacy policies has been audited by a third-party independent auditor. There are a couple of certificates such as SOC 2 Type 2 or High Trust, which are actually going through those protocols and see if these like vendors have implemented those. And if, for example, there is a chance that that AI vendor is integrated with your EMR, you can ask your EMR and see if they have actually vetted or check all of those documentation from the AI vendor. Usually that's the case. So if the partner is an official partner with the EMR company usually go through a very comprehensive assessment of the solutions. And then you have access to many other resources. So the two most important documents is privacy policy and terms and conditions. And they should be publicly available on the company website. So you can go through them and see that if they are readable, if they are clear, if there is any unknown that you are looking for. And if there is, you should have a chance to talk to a privacy officer of that company and ask for documentation about how they implement AI, how they address biases, and many, many more. So if you follow all of these guidelines, you lower the risk of adopting AI. But on the other hand, there is a gap in the regulation. So since AI is evolving very fast and there is a huge adoption in the industry, the regulation hasn't caught up. So, for example, we have received multiple RFPs from different entities in the US and Canada. And if I want to categorize their position, I come up with two categories. Some of them demand the AI vendor to delete the data, and they are not allowed to use data to train AI. So you're not allowed to use anything, and you should delete the data after some time. The other party, this is more prevalent in the US, they said that if you properly de-identify data, you can only use the de-identified data to fine-tune your product for the value offering that you are actually currently offering to the providers. So they are okay for the identification of the data. Both of these methods have some gaps. For the first one, those who like ask you to ask the vendor to delete the data and not to use the data to fine-tune and improve their product. If we acknowledge that each AI system has biases and accuracy issues, it would be extremely difficult to address those if the output data of the algorithm cannot be used during the fine-tuning. It's true that like vendors can hire people like external annotators or augment data internally. But in order to truly address those gaps, sometimes the vendor should need to look at the data and see where are the shortcomings of the AI to be able to address them and improve the product. For the second approach, if the identification is allowed, one should assess the identification method of the vendor and its efficacy. For example, if you can ask them if they are using safe harbor or expert determination and many more things. I think this is the last slide, and it is the best segue to pass the discussion to our panelists and see how they are seeing the evolution of AI and what they recommend in terms of adoption.
That's awesome. Thanks so much, Hesam, for that. I'm really excited to get into the next segment now, which is our expert panel. We have three awesome panelists joining us today, Amy, Tracy, and Jeremy. Just before we dive into introductions, I just want to highlight as well that, again, in the bottom taskbar of Zoom, we have a Q&A. So if there's questions that anyone would like to have shared with us so that we can pass them along to our panel at the end of the discussion today for questions, please feel free to do so. Or I can see your questions shared in the chat as well. And we'll make sure to try and get to as many as we can. So before we dive into our first set of questions, I thought we'd just start with some introductions. We'll go left to right. So Tracy, we'll start with you if that's okay. Just give a quick introduction of yourself.
Absolutely. Thanks so much for inviting me. It's great to spend some time with you all today discussing my favorite topic. My background is privacy. I spent about 15 years in the Ontario government, both on the administrative and regulatory enforcement side, dealing with a lot of these sticky issues that folks have been talking about today. I'm now fortunate enough to work for myself for Privacy and my consulting company, and was lucky enough to work with the Tali folks last year on helping them polish and get ready to have some of these conversations. As you can tell, they're already thinking about these hard issues. And in a lot of cases, the questions that customers and clients and regulators have are the ones that we're talking about today. So I'm excited to be here. Thank you, Harrison.
Thank you so much. And Jeremy, how about yourself?
Yeah, I'm a privacy, security, and health regulatory lawyer based in Vancouver. My day job is with TELUS Health. I support our compliance programs for our provider products. So those are the EMRs and patient engagement tools, as well as our pharmacy products. So that's me.
Great. And Amy, over to you.
Yeah, hi everyone. Great to talk to you tonight. I'm Amy Leopard, and I'm a healthcare lawyer and at Bradley A. Rent Bolt Cummings, resident in our Nashville, Tennessee office. And I'm the co-head of our privacy security team and on our AR team. In my former life, I was a hospital administrator in academic medical center and community hospital settings. So most of my regulatory background has dealt with medical records, information systems, HIPAA compliance, and I tried to bring to that some practical thoughts from having been in on the provider side.
That's great. Thank you so much for the introductions. And again, Hesam, thanks for the really thoughtful presentation. I think it segues really nicely for us to go into our first section of our Q&A. I actually really liked in Hesam's presentation, just talking about how there are so many misconceptions about how to approach privacy. For example, even if you think about HIPAA compliance and the nuances of what that actually means. So there's a lot that people have to uncover with these topic matters. And so I would love to start our panel just with something very introductory and put ourselves in the shoes of an organization that is looking to adopt an AI scribe or look at an organization who is looking to partner with an AI scribe. And I would love to ask our panel that for an organization in that position, considering an AI scribe, where would you recommend they start? How should they approach the very complicated and fast-changing landscape of privacy? And I'll maybe pass it over to Amy to get started.
Yeah, I'll jump in. So I think it's really important when you get started, the most important first step is to kind of define the use case that you're going to be using the tool for. And then within that, to clarify the role of human oversight. So there is a big difference between the regulatory pathway for the tools that Hesam has described, where the clinician is intimately involved with the patient and it serves as a professional intermediary, versus if you think about like a chat bot practicing medicine autonomously. So in this use case, there's a human in the loop that has responsibility for human oversight. And that's a good thing because in the US, every state regulates the practice of medicine, and state medical practice acts and Medicare rules state that the responsibility for diagnosis rests with the provider. So, so having that input that comes to the provider, having a use case that involves a tool being used by a provider instead of autonomously by the consumer, really streamlines your analysis of how to consider all of the vast rules. And we're kind of in a situation in the US, at least, with a patchwork of regulations developing on AI in particular. We have state level consumer protection, privacy laws that are expanding into AI. And AI, I just saw yesterday that Virginia sent a bill to the governor to be signed. And California has certainly, in January has amped it up by having some state laws that govern AI in particular. So, being aware of those state level concerns and being in a position to kind of keep in mind that the rules that apply to you as a provider for that use case are still in effect, even if they're not AI rules. So in other words, things like HIPAA, things like US discrimination that prevents, that has protected classes for age and disability. So all of those same rules are going to apply even while we have some of these shifting sands, at least in the US.
At the end of the day, don't forget your use case, and at the end of the day, where the responsibilities truly do lie, which is still on the practitioner, of course, which is so helpful to help orient the conversation where, how you're using AI and the use case matters a lot. And so I'm curious, Jeremy, on your side, um, if a clinician is thinking about implementing an AI scribe and has these considerations that they're thinking through, is there anything from your side that you see? How does it differ whether if it's either a clinician or an organization? How would their approach to adopting from a risk management perspective? What's unique about AI scribes?
Yeah, and I think we need to be a little bit careful again about that uniqueness and our approach to AI exceptionalism, because I think we can zoom back out and apply a lot of our same due diligence principles that we apply in other privacy, security, and patient safety contexts. To emphasize Amy's point, again, these responsibilities flow to the provider, most of whom are regulated health professionals. So that's more or less the bad news, which is that there's a significant amount of personal responsibility that goes into this due diligence analysis. The good news is there's great work being done in this area. And there's no reason why individual providers, clinical managers, and operational personnel shouldn't be piggybacking on a lot of this work that's already being done. I just specifically wanted to draw your attention to Professor Teresa Scassa at University of Ottawa has just published a paper, was publishing a paper specifically on doing a privacy analysis of AI scribes in the Canadian context. And I can also share a link here with Daniel Solow's paper, considering just the ability of privacy laws and regulation generally to take on AI-related considerations. So there's a lot of good work coming in the academic context. And then, more importantly, I would push all of the providers on the call to really piggyback on some of the efforts being led by their professional associations. So that includes groups like Doctors of BC here in BC, and Ontario MD in Ontario, as well as regulatory bodies like the College of Physicians, and various ministries of health. There's a lot of AI scribe related working groups underway, and they're putting together pretty comprehensive due diligence checklists that help individual providers navigate the selection process.
Right. And it's so true. Like when on our side as the vendor, working with clinicians, one of the things we wanted to take is the same approach of yours. There's a lot of ongoing great work that's being done in the space, and we want to make it easy on clinicians to have the resources they need. So we've even, as Hesam mentioned, done work to prepare infographics, educational materials for patients, FAQs to help navigate the privacy and security questionnaire process. Don't have to reinvent the wheel. There's so much great information out there, and hopefully you can get it through great resources like experts on our panel or from the vendor that you're working with too. And Tracy, I'll pass it on to you. Is there anything that you'd like to add just to this this question of where should folks start? What should they be thinking about when they're getting going with an AI scribe?
Well, as the illustrious non-lawyer, I would say from a computer science and implementation perspective, what you should be looking for is the person who's actually building the thing to come and talk to you and to participate in that conversation. And I think this is where companies like Tali that are particularly small and ruthlessly efficient have an advantage when you're talking to your customers, because your chances are that you're actually talking to the people who know how the technology works and can help explain it to you in plain language. And it's really incumbent upon your vendor to do that. They shouldn't just be giving you the pitch of how this can save time or money, which it definitely can. They should also be able to tell you, where does the data end up? How long do we keep it for? What are some of the issues or risks that you would be taking on? Because whatever products you're using, you're going to take on a risk. And ultimately, that's a business decision that needs to be made in conjunction with your vendor.
That's great. And that's certainly, a philosophy that we want to try and hold on to for as long as we can, just being, readily available to help address questions and be a partner in all of this as well. One of the things I am noting our chat. So one thing I'll mention is Jeremy was great enough to share the links. We're going to make sure to email out these resources to everyone after the fact, as I'm seeing that some folks might not be able to see the chat that's being shared to everyone. But if you're able to see Jeremy's links, that's great. But if anyone can't have access to them or can't see them, we'll make sure that they're sent out after the fact too. Anyways, just a quick housekeeping note. But we'll dive into our next set of questions. So thank you all for just the starting point to help ground the conversation. But another key thing that I know that this is frequently asked for us too is AI is changing really, really fast. And in particular in the context of privacy. Is there anything top of mind in the news or any latest trends that you think everyone should maybe take away from tonight's conversation and go look at or go explore? And so again, I'll hand it off to Amy, or if anyone would like to jump in just to kick off this topic of what's really catching your eye and attention in the space right now.
Well, one thing that just caught my eye last week was that the California, in the US, the California laws kind of tend to lead the nation and are usually pushing the envelope. And the California Attorney General put out guidance about 2 weeks ago, talking about how AI applies in the healthcare dynamic. So that's important just to kind of keep attuned to that, because one of the things that they brought up in that guidance was the importance on the bias and discrimination front, not just on clinical care, but also on using AI for scheduling, and the impact that bias in a tool could have in, taking people of a particular demographic and presuming that they're not going to show for appointments and double booking them, that the California Attorney General would consider that unlawful discrimination, right? So just, we're going to begin to think of all the different ways that that these tools are used, and so bias is going to continue to be an important question in looking at the tool's intended use.
Enough. Jeremy, how about yourself? What's catching your eye? What's top of mind for you? Oh, you're just on mute. Sorry about that.
That way it doesn't catch my typing here. Just an acknowledgement of, I'd say, general uncertainty in this space. And one thing I've tracked quite closely is just the level of humility that seems to be associated with AI-related expertise. The further you go up with regards to knowledge of machine learning algorithms, the more it seems that the scientists who are building these systems will convey awe or reverence, or even just acknowledge that there's a certain kind of mystique or black box related to the technology. So I think that's something that's kind of repeatedly caught my eye. And for the rest of us, that certainly informs our proceeding with caution approach. But the other thing I think is a debate we're seeing globally right now in relation to the concept of AI regulation, and whether or not we need to introduce entirely new frameworks, or whether or not we can adapt existing privacy and security frameworks to address some of these newer risks. And I can certainly share what some of the stuff that's going on internally within our organization. But yeah, I'd say the overall level of uncertainty, and I'd say nowhere more so than in the litigation space. There are any number of lawsuits that have been filed across the U.S. in particular right now, and I think a lot of us are making popcorn and just waiting to see how those shake out.
And I'll hand it off to Tracy as well to give us her take as well.
So I think we've moved to a space where we're going to accept, in the healthcare field and beyond, but specifically in healthcare, that scribes are indispensable. I mean, I spend most of my day in meetings that have Gemini automatically taking transcriptions and translating in real-time languages. I think it's a wonderful accessibility-focused feature. I do think it's a grievous error to continue to call for additional regulation in this space. We have a lot of great regulation. And to Jeremy's point, A lot of it can be extrapolated really easily into new technologies, and that's kind of how it's supposed to work. One of the things that concerns me is that in the face of all this uncertainty, this continued call for regulation is being answered on some level, and I would say wasting resources. I mean, with all due respect to the attorneys on the call, I don't think the answer is to have legislation that defines what the de-identification threshold is. I don't think the answer is to have small cell size determined by precedent-based law. These things move too fast, and the technology around this needs to be determined by the people who are building it, with the input from the stakeholders and groups that will be impacted and managed and have their data managed in it. But the enforcement action is a whole separate action and a whole separate conversation, frankly. So yes, there are hard questions. Yes, as a practitioner, I would be concerned using any of this technology and do my due diligence and talk to the vendors, make sure they have PIAs and TRAs and retention schedules, understand enough about how the technology flows to be able to adequately explain it to my patients. I'd also accept the fact that there's uncertainty. There's going to be uncertainty in the use of all this technology for a good long time. I don't think that uncertainty is any different than any other kind of healthcare related issue that has uncertainty. New treatment have uncertainty, new equipment has uncertainty, new diagnostics have uncertainty. We seem to get caught up in the notion that AI uncertainty is somehow special, and forget the fact that humans deal with uncertainty all the time. And the best way to counteract that is sessions like this, talking to each other, doing the research that Jeremy and Amy both suggested for the resources that are out there, and understanding that at no point in time is anyone, any vendor, any computer scientist, any engineer going to say to you, it's all going to be fine. There's no risk. Go ahead. Everything will be great. Because they can't.
Yeah, I agree. And I think, we were talking about this the other day, but I think this is very similar to the time frame when we started adopting EHR, and everybody was asking these same questions like, oh, if I use EHR, what if I kill a patient? Whose fault is it? And, somehow we punched through, and as a community and as an industry, dealt with that ambiguity, dealt with that uncertainty. There was no law of the EHR. There's laws that already apply to bias, discrimination, privacy, security, consumer protection. And so keep that in mind, that you are going to be facing ambiguity, but what's reasonable and appropriate changes every day.
Awesome. I'm gonna shake up our questions just slightly, but I guess like the one thing I'm sure, like in trying to understand all the great points that you shared now, is how does an organization or a clinician move forward if they've identified, as Tracy said, that they view AI scribes as indispensable? It's something they're really interested about, but they're cautious and they want to proceed with care. I'll want to jump to that question and just ask, for the panelists on the call, how would you recommend, or what do you view as a responsible way to proceed with care? What does the approach look like? And how do we just kind of move forward in the face of all of this uncertainty and the fact that the space is just moving so quickly that it might be overwhelming for folks to consider everything that comes with new regulations or things being discussed. So how do they proceed with care? How do they get started? Oh, we'll start with Tracy on this one. We'll shake it up a little.
Okay, thank you. Well, I think the first thing you have to do if you're an individual practitioner is get comfortable with the technology that you're talking about to a certain degree. I'm not suggesting that by any means you need to understand how de-identification protocols work or how the data is collected, but you do need to understand enough that when your patient asks questions, you can explain it. And every provider out there, including Tali, has resources and should have resources to help you engage in that conversation. If you're part of an organization, then it becomes more of a business decision, to be honest. I mean, your healthcare organization, your clinic should decide, just like any other business decision, what threshold they have for the risk and where they want to place that in the context of the patient care that they're providing. We keep falling back to privacy is special or AI is special, but it's like any other investment. You know, if you're as a hospital going to move to a new facility, going to create a new parking structure, invest in a new point of sale system for your cafeteria, you go through a series of business decisions. You should do the exact same thing if you're adopting any kind of new technology. Keep it simple. I mean, the process for evaluating these technologies shouldn't be any different than making any other decision you would make in the course of running your business.
And Jeremy, have yourself, what do you see in that perspective? Would you agree?
Yeah, well, I've already recommended you should, again, piggyback on some of these professional associations, especially to grab some of those checklists that they've made available. The other two things I'll mention is one, every consent is an opportunity to have a conversation with the data subject. And again, I was visiting a physician just recently who was using Tali, and they had a posted notice in the exam room. And it emphasized that if the patient had any questions, they're encouraged to speak with their provider and to have that conversation. That's what informed consent really means. It's not a checkbox that provides no options. It's a conversation with the person whose information you're collecting. So that's the other thing. And then internally within TELUS, I should emphasize, as Tracy's been noting, it's an exceptional technology in many contexts, but the analysis that applies here, we are, with every new AI-powered integration, we are doing a consistent privacy, security, and patient safety analysis. However, there's also an additional set of questions that we've layered over top of that. And so that flags some of the ethical considerations. And so examples would be, what is the risk that this introduces some bias within the algorithm? Or my all-time favorite question, which we've learned the hard way, which is, if someone found out you were doing this, would they feel weird or uncomfortable? And I think that question is incredibly important because we're all looking for regulatory guidance on these details, and we're glossing over the fact that if it makes people feel weird, the reputational harm that can follow from that collection of information may not be worth it. So again, everyone needs to follow their own intuition a little bit here in the absence of some of those regulatory guardrails. But otherwise, there's, a lot of these mechanisms already exist, and we need to just unfortunately put in the work to do the analysis.
Amy, how about yourself?
Yeah, I was just noticing someone in the chat features kind of embellishing on that with the fact that using an AI scribe may actually capture more and be more accurate documentation of an encounter. But the problem being that the clinician just may get so comfortable with it that they save the note without doing a proper review. So I think it's important that, just that, again, that human in the middle, you are going to capture more information. You may capture more accurate information. It is the responsibility of the practitioner, though, to adopt that as their own under their license and affirmatively place that in the medical record, right? So that's the moment at which you have this opportunity as a practitioner, as a clinician, to make that clinical judgment. That belongs to the clinician, and I don't think we want it any other way.
Tracy or Hesam or team, just if you have anything else you'd like to add before we jump into the next question, or is that a good spot to end on? Okay. I want to be mindful of time, so we'll probably go through one more question, then we'll open it up to, because there's a lot of lively chat and discussion going on, and I want to make sure we address that. So maybe what we'll do is we'll just discuss about where we go from here. Before we dive into the Q&A, is there any key learnings or insight that the panelists would like to just share with the group before we kind of give everyone a chance to have their questions answered? I just want to make sure we give everyone lots of time for that too. So anything you haven't had a chance to share yet on this topic to help bring some comfort and some good food for thought for everyone on the call today, what they should take away from today's discussion.
I mean, I'll jump in with something pretty straightforward, which I think we're all sort of saying in different ways. This is new, but new things aren't new. We've all had to deal with new technologies over the course of our lives. The internet being a pretty huge one, and we all adapted and figured out how to do consent and how to do patient conversations and how to do EHRs. I don't think this will be any different. And the key is coming to sessions like this and talking to people and asking questions. And that's how we'll get to the next standard for what is a reasonable person test, which is, I think, what Amy was kind of alluding to earlier. This is about meeting the needs of your patient. I mean, if ultimately you're not sure whether they want you to use this product or whether they think it's beneficial, ask them. I mean, that's a pretty easy way of dealing with risk.
Awesome. And Amy, how about yourself?
Yeah, I would just, reiterate that kind of what we said at the top of the hour in your presentation for Tali, is that this is a partnership approach with your vendor. And so understanding the tools intended use, whatever vendor warnings there are, asking questions about how the system was tested and validated, and, just seeking some details on what the vendor's risk management strategies are. Under HIPAA, you're expected to leverage your vendor's security risk assessment as a provider. You're expected, when you're handing over that risk to your vendor who's regulated under HIPAA as a business associate, that vendor gets a lot of leeway with how that information is used. You can share patient data for treatment and healthcare operations with your vendor who's a business associate regulated by HIPAA. And the business associate agreement that's required, limits how the vendor uses it and can't sell it, and is permitted to de-identify it with the permission of the provider. So you can incorporate a lot of your risk assessment piece of this, particularly on the privacy and security side, by having that conversation and maintaining, written security verification, SOC 2 or high-tech reports, and other types of, broader risk assessments that would apply to AI. So use that vendor relationship to help build your assurance file.
Great. And Jeremy, we'll pass it to you.
Yeah, there's a lot of questions relating to compliance with specific laws, primarily public sector and private sector privacy laws. We have this kind of general definition of compliance, which is, adhering to the requirements to which the organization or the health provider is accountable. So I always then say, what do you mean by compliance? Like, give us the line items, and we can then confirm each of those line items. And what people would prefer, of course, is to have a check mark, which follows a certification model. So when it comes to some of the challenges we're facing here, again, I don't want to get distracted by some of the underlying tooling. The number one obstacle in Canada is actually the division of powers in the Canadian Constitution, which is that all of our ability to implement this technology gets hung up by the fact that healthcare is provincially administered, and it makes it very, very difficult for us to deploy these technologies, as exciting and as powerful as they are, at scale across the country. So that is, again, a major impediment. And I'm not going to throw out quick solutions there because, again, we're back to kind of where we end up discussing most healthcare related issues. So, what's I think so exciting about this is that everyone can see the immediate clinical value. Elsewhere in the world of AI discussions, there's a lot of, I'd say it's pretty clear that it's led by hype in different capacities. Whereas in the context of AI Scribes, it's led by the clinical advantages. And that the AI is providing the tooling to make that happen. So it's actually a very different and exciting discussion from what we're seeing in other contexts.
Great. That's awesome. I do want to be mindful of time, so we'll probably leave it there. But I guess I just want to build on everyone's points just by saying around this notion that at the end of the day, it is a partnership with your vendor. And we're excited that what we'll do is at the end of today's session, in the coming days, we're going to send a privacy checklist that Tali has put together as just a great starting point, in addition to how our panelists have framed things that you should be thinking about. Other key topics that Hesam has mentioned and our team think are really useful when evaluating privacy in the context of getting started with an AI Scribe. So for anyone who'd like to get access to that, we'll make sure to share it. But now we'll dive into some questions that everyone's been asking. Hesam, I know that you had sent some responses out to some users on the chat. We've now opened up the chat so everyone can see it. So you might have to just copy your answers and just reshare them with the group so that everyone can benefit from those responses. I'll start going through a few, but then of course, if we don't get to your question directly, we're going to make sure to answer by email all the ones that go unanswered for now. I saw one asked at the top of the Q&A. Was this notion of trying to understand the difference between compliance and being certified. So sort of the topic matter that Hesam mentioned about HIPAA compliance versus being certified for something. What's the differential? I know our panelists have tried to answer some of those questions, but I thought everyone on the call could benefit from that one. So is there one of the group who'd love to jump in and just give their perspective on that one? Yeah, go for it, Tracy.
So to me, this is a really simple marketing thing. If you are certified in something, there's an independent third-party arbitrator who has come in and stamped approval on your claim to whatever certification it is. In some cases, there are industry associations that will provide certifications for you if you pass a certain benchmark, ISO, NIST, et cetera, et cetera. Compliant always makes me giggle. I mean, I would tell you I'm compliant when I drive my car, but we all know that's not true. I've done a rolling stop. I've ran a yellow light. Like compliance is that's just a nice word. That's all.
Yeah, to Tracy's point, it really depends who's saying it. So compliance generally is driven by sales and marketing teams. So that's often where you'll see that terminology. You know, if you really want to back up compliance, one of the kind of clever ways to do it is you identify your compliance obligations, and then you can map those against some type of assurance product. And I know I think Amy mentioned SOC 2 reporting, which is quite common in North America. ISO certifications are more popular globally, especially in Europe. High trust certification, the list of those certifications goes on. You know, providers like AWS and Google Cloud Platform may have 50 to 60 different assurance products available to support their representations with regards to compliance.
Got it. Anything to add for that, Amy?
No, just, you know, I think there are a number of different frameworks, and, you know, the frameworks are there to help you simplify how you go through and, you know, make sure that you're comprehensive.
Got it.
So I'll mention one, maybe I'll pitch, Amy's not going to sell her own services here, but I'll just mention that some of the best money I've ever spent was retaining a lawyer and privacy professional to provide an opinion and a PIA on a compliance analysis. That is the opposite of a marketing document. So that was to understand our own internal compliance obligations. But that's, again, how you would inform your confidence in these areas.
Cool. This one might be a question that Hesam can weigh in on. I thought it was very interesting as well. I was talking about, like, as the purpose of our tool, so much data is being processed in order to use an AI scribe. What are the negatives, so pros and cons of data de-identification? So to further improve the AI scribe, I'm curious, Hesam, if you have a perspective on how folks should be thinking about, because that's a common question even in customer success that we get. Is the data de-identified? What does that mean? What are the pros of us letting you do so, the cons? If you have some perspective, that'd be great.
So as Jeremy also mentioned in the Q&A, there is always risk of re-identification. So when someone says that I de-identified the data, they need to provide you with some documentation. What was the protocol? What was the framework? What was the test data? How did they evaluate their de-identification method? And what technique did they use? Did they use safe harbor, or did they use like expert determination? And since there is always risk of de-identification, if you use the identified data, there is a chance that you leak some of the PHI to the training data of the LLM. Which means that if, for example, I visited Harrison and I use Harrison data and Harrison's name was within the node, I use it to train my LLM. And the next user, when they ask like, what is the date of birth of Harrison, then LLM may be able to generate that. So there are many articles on the web that actually explore, like from the scientific perspective, explore if they can extract some of these from OpenAI. initial version of the OpenAI, there were some chances because they are still scraping and using all of the public data to train their algorithms, but they are actually doing safeguard around that. But if someone properly implements the identification and do proper expert determination, the risk is very, very low in terms of exposing PHI to the algorithm.
Fascinating.
Yeah,
Um,
I'll just mention because it's a common red herring in the de-identification context. So when you review the services terms for your service provider, you'll often see language that speaks to the vendor may use de-identified information for certain secondary purposes, including improving the overall product performance. You should definitely ask your vendor about what they intend to do. But that is not a risk specific to the AI Scribe or any AI context. That term has been there for years, over a decade. It primarily or historically has been used so that software vendors can use anonymized analytics from product usage so that they can inform how to better build their product. But there is a legitimate concern with, well, what are those secondary uses of the data? And what assurances do we have that it's de-identified while the vendor is using those things? So again, worth asking that question, but don't read too far into that term being in your vendor's services agreement.
And Hesam, would you be able to give an example? So for folks who maybe do ask the question of their vendor, what should a vendor provide them to help answer this question effectively? What have we done, and what should folks be looking for?
There should be a large document outlining the technique that they use, the type of training data test data that they use, and the evaluation metric with the accuracy and recall. So they need to document all of these things and then say that, okay, this is the person who is responsible for the identification. These are the individuals who have access to the PHI. And these are the individuals who use the de-identified data. And this is, as Jeremy mentioned, this is how the organization is using those data. For example, if you are doing that, like there were some incidents in the past that people de-identified data and sell those data to third party, which raised some legal issues one way or the other. So the purpose of use of the identification data, the identified data should be outlined too.
Fair enough. I know we're at time. Just want to say thanks so much to our panelists for contributing to this conversation. Such great engagement from the audience and guests joining us today as well. So thank you so much. We're going to make sure we send responses to everyone with answers to their questions. Jeremy and team sent some great resources. So we'll make sure that those are also shared with everyone on the call as well. But thanks again for joining us tonight. And we're really appreciative of, again, our panelists again. So take care, everyone, and have a great evening.
Thank you.
Thank
All
you.
right, take care, everyone. Bye.
Thanks, everyone.